Health experts from around the world say millions of innocent lives continue to be lost every year due to pregnant women neglecting their responsibilities and a lack of political will from their leaders. Well, they were speaking at an event aimed at promoting awareness on newborn and maternal deaths in Sandton, north of Johannesburg. Our Health Minister Aaron Motsoaledi, representatives from the World Health Organization and civil society movements attended the event organised by children's rights organisation Save the Children. Now, this is part of a global plan aimed at ending newborn and maternal deaths. Well, for more, we have in studio Mr. Patrick Watt. He's the Global Campaign and Advocacy Director from Save the Children International. Good afternoon, Patrick, and thank you for your time on the PM News Desk. Look, no child is born to die, and no mother should die while giving birth. Yet every year millions do. Why is this?
Well, there are a number of reasons why children are dying. I mean, fundamentally, people are dying because of poverty. People are dying in the poorest countries from a lack of access to healthcare, lack of access to nutrition, the things that many people take for granted. And so this meeting happening in Johannesburg this week is really trying to focus efforts on how do we finish the job we've started in reducing child deaths. The world's made a lot of progress, but there's more to be made. And how do we ensure that we're setting ourselves in a longer-term ambition, looking ahead to 2030? Can we actually complete the job of ending preventable maternal and child deaths by 2030?
5.5 million babies dying every year. Of course, those statistics might have changed. The figures are staggering. The sad thing, Patrick, is that these newborn deaths could have been prevented. Tell us how.
Well, many of the deaths, the child deaths that are happening each year, the numbers are actually over 6.5 million each year around the world, and about half of those deaths in Africa. Many of those deaths are in the newborn period. They're in the first month of life, when the child is at their most vulnerable. Yes. And an awful lot of those deaths are down to the simple fact that mothers aren't giving birth to children in health facilities. Millions of mothers are giving birth without skilled birth attendants, without midwives, without access to proper medical care. And many of them are actually giving birth alone. There are millions of mothers across Africa giving birth alone. And this puts mothers and newborn babies in extreme danger. So the first thing is to tackle this challenge of ensuring that every mother, when they give birth, are supported by a skilled health worker. And then it's also about ensuring that when they get that healthcare, it's quality healthcare. So you've got a health worker with the training, you've got the right equipment, you've got the right drugs. Many of the interventions that can save newborn babies' lives are very simple, very low cost. Their difficulty is that oftentimes countries don't have the healthcare system to actually ensure mothers are getting the proper care they need.
Tell us about some of those interventions.
Well, some of those interventions are things that people wouldn't even think of as medical interventions. Things like exclusive breastfeeding. Breast milk has enormous importance to child nutrition, but also to ensuring that children are resistant to basic diseases. Many people describe breastfeeding as the first and the most effective vaccine. So ensuring exclusive breastfeeding from the mother from the moment a child is born is incredibly important.
The kangaroo care?
Kangaroo care, where you take the newborn child and you ensure it has skin-to-skin contact with the mother, that regulates the newborn child's body heat.
And perhaps something as simple as the washing of hands.
Absolutely. So basic hygiene measures and ensuring, for example, that the umbilical cord, when it's cut, is sterilised. So there are some very simple things that in and of themselves don't cost much money. A lot of the time it's about knowledge, and it's about mothers actually knowing what their rights are and what is needed to protect them and their babies. All
right, for a very long time, what you call the global newborn health agenda, it's been off the radar. And we've seen progress, like you've mentioned, in childhood illnesses in poorer countries, pneumonia, malaria, diarrhea. But we haven't had nearly as much progress in tackling newborn deaths. How do we raise the visibility of the newborn health agenda?
And that's a critical challenge because, as you say, we've reduced child deaths around the world. But a growing proportion of the remaining challenge is in that newborn period, in that very vulnerable first 28 days of life. And so one of the things that's been happening this week in Johannesburg is that there's been the launch of an Every Newborn Action Plan, which was put together by the UN agencies with organisations like Save the Children. And that plan is really setting out an agenda for what governments need to do with civil society, with the private sector, to tackle this issue.
Of course, we'll need a great deal of political will and commitment to make that work. And as Africans, we can't always rely on outside help.
Absolutely. And I think the concern at the moment is that although actually the private sector and civil society have stepped up with commitments, we haven't seen the same level of commitment to this plan from governments. We've had endorsements, but what we now need to see is the real policy and budgetary changes that will drive implementation.
Thank you, Patrick. I'm afraid we're going to have to leave it there. That was Patrick Watt joining us on the PM News Desk from Save the Children International. Moving on to other news now.